I care for children undergoing cancer treatment at Siteman Kids at St. Louis Children's Hospital. And I'm very honored to be a part of this group of physicians with this focus who are so dedicated to helping these kids and families get through such a difficult part of their lives. I always knew I wanted to be a doctor, but when I was in middle school, my best friend's little sister got leukemia. And I think just seeing everything that their family went through, and then a couple of years later, a cousin in my own family developed cancer. And so seeing both of these families have to deal with such a horrible illness made me think, I want to be that kind of doctor. I want to be able to help families going through this. I also knew I always wanted to work with kids. And so then I thought, okay, I can help families who have kids going through cancer. What brought me to Siteman is how much focus there is on offering patients the best in standard of care, but also the cutting edge new treatments, new therapies. Some were developed here, some are in collaboration with other institutions, but we are able to provide our patients with the best care we possibly can. I think one of the most rewarding parts of the research that I do is knowing that I am part of a team of people here at Siteman who are working to make the newest, the better therapies for our patients. And if I can be some small part of that, where I can ultimately help a patient have a better chance of cure, have less side effects from their treatment, and ultimately live longer, healthier, happier lives, that's what's so rewarding for me. When I am taking care of a patient with cancer, my area of clinical expertise is on stem cell transplantation and cellular therapies. So often these are patients who have already been through a number of treatments for their cancer. And either they have a very high-risk cancer or the previous treatments didn't work. And that's when they need me. And as a pediatric hematologist and oncologist, I take care of the whole family. So I have the patient, the child who is undergoing this, but also the parents who are the decision makers and who are very scared. And what I love best about the clinical work I do is that I feel like if I have helped a family to understand what their child is facing, to understand the medical decisions that need to be made, and to help them to make the best decision for them and their family and their child, that's when I feel like I've done my job. It is so rewarding to see when the work that I have done or that I've participated in getting through clinical trials and reaching patients. It's why I do what I do. I always want my research lab to have a focus on, yes, we're doing experiments to understand basic biology. We're doing studies to understand how cells are functioning. But how is this going to help my patients someday? That is always what's underlying all my thought processes in what I do and focus the lab on. And so right now I'm actually starting to develop a clinical trial based on some of the work I've done here at Siteman, and I'm very excited for being able to bring this to patients. Many people don't know how many years of basic science laboratory research it takes to develop something to the point where we can even start a clinical trial. And so for me now to be finally developing that clinical trial that I have done the basic science work on for so many years is so rewarding and really just fills me with hope for my patients and hope for the future that I have played some small part in making their treatment course and ultimately their cure better.